Sterility or infertility is a condition that affects individuals and couples because of the inability to produce a biological child. It is also essential to recognize that sterility can affect both men and women equally. Couples and individuals may suffer greatly from infertility, which can have an impact on their relationships, mental health, and self-esteem. Counseling, support groups, and access to educational resources can provide vital support and guidance throughout the fertility journey. By recognizing the complexity of sterility in both genders and offering comprehensive care and support, medical professionals can help individuals or couples in overcoming the difficulties of infertility and working towards their goal of establishing or growing their families.
First of all, let's take a look on symptom of sterility. Symptom of sterility in men can include, first of all, very small firm testicle. If testicles are too small to produce the testosterone hormone, then their fertility gets affected badly. Usually, a man who is born with Klinefelter syndrome, which is caused by one or more additional chromosome, faces such issues. Secondly, testicle pain or swelling. Pain or swelling in the testicle is not normal. There are many reasons for this condition that includes twisted testicles, testicle infection, building up of fluid around testicle, and hernia. Thirdly, for the symptom of sterility in men is erectile dysfunction. Erectile dysfunction, also known impotence. Erectile dysfunction is inability to maintain an erection during a sexual intercourse. It can result from various factors including physical health issues, physiological factors, and lifestyle factors. In addition, symptoms of infertility in women can include irregular period, painful period, and hormone fluctuation. For irregular period, a menstrual cycle of less than 21 days or longer than 35 days is considered abnormal. This may be caused by polycystic ovarian syndrome or hormone issues. Secondly, for painful period, many women experience cramps for a day or two during their periods. This is usually bearable. However, some women may have very painful cramps that interfere with their daily life. They may also experience a heavier than normal blood flow. It can be a sign of condition which can contribute to infertility. Thirdly, for hormone fluctuation, a number of hormones impact fertility. This includes thyroid hormone, follicle-stimulating hormone, progesterone and luteinizing hormone, and prolactin. Symptoms like excessive facial hair growth, acne, or weight gain may indicate hormonal imbalance that can affect fertility.
Next, we're going to look at the statistic in our country. Infertility rates in Malaysia range from 10% to 15%. Sterility rates can be influenced by various factors, including changes in lifestyle such as smoking, excessive alcohol consumption, obesity, and exposure to environmental toxins can negatively impact sperm health, further contributing to male sterility. As for women, age factors and hormonal imbalance can contribute to sterility issues as well. Next is medical advancement. Improvements in healthcare infrastructure, access to reproductive health services, and awareness about fertility issues can also impact infertility rate. Lastly, socioeconomic condition. Socioeconomic factors such as access to healthcare, education, employment opportunities, and cultural norms can also influence fertility rates.
So, what are the causes of male infertility? Male infertility can be caused by various factors starting from hormonal imbalances to lifestyle choices. There are 3 common causes of male infertility. One of the causes of male infertility is varicocele. Varicocele is a condition characterized by enlarged veins within the scrotum, similar to varicose veins that occur in the legs. It can raise the temperature of the testes, which can affect sperm production and quality. Additionally, it can also disrupt blood flow to the testicles, leading to decreased sperm count and motility. It is estimated to be the most common cause of male infertility. Apart from that, factor of male infertility is sperm abnormalities. Sperm abnormalities include a wide range of issues that affect number of sperm, shape, and motility. Oligospermia, which is low number of sperm, or azoospermia, which is complete absence of sperm, can significantly reduce fertility. Abnormalities in sperm morphology, such as misshapen or immature sperm, can also decrease the ability of sperm to fertilize an egg. Poor sperm motility, where sperm cannot swim properly, makes it difficult for sperm to reach and penetrate an egg. The last cause of male infertility is hormonal imbalances. Hormones play a crucial role in sperm production and maturation. Disruptions in hormone levels, such as low levels of testosterone, can impact sperm production. Conditions such as hypogonadism, where the testes produce little or no hormones, can lead to infertility. Additionally, hormonal imbalances involving other hormones, such as thyroid hormones or prolactin, can also affect sperm production and fertility. Moving on to the female infertility. There are 3 common causes of female infertility. The first one is polycystic ovary syndrome, PCOS is a hormonal disorder that affects women of reproductive age. It is characterized by irregular periods, high level of androgens, male hormones in the body, and small cysts in the ovaries. These factors can disrupt ovulation, making it difficult for women to conceive. Another cause of female infertility is endometriosis. Endometriosis is a condition where tissue similar to the lining of the uterus grows outside the uterus, often of the ovary, or fallopian tubes, or other pelvic organs. This can lead to inflammations, scarring, and the formation of adhesions, which can interfere with ovulation, fertilization, and implantation of the embryo. Blocked fallopian tubes is also one of the causes of female infertility. Fallopian tubes are essential for transporting eggs from the ovaries to the uterus and providing a site for fertilization to occur. Blockage in the fallopian tube, often due to infections, pelvic inflammatory disease, or previous surgeries, can prevent the egg and sperm from meeting and resulting in infertility.
And now I'm going to explain about how to sterility among male and female. Okay, I start with male first. There are 3 treatments for male that I'm going to explain, which are lifestyle changes, supplement intake, and HCG treatment. Okay, first one is lifestyle changes. So how does change your lifestyle will save you from getting sterile? Okay, one should stop smoking and drinking any alcoholic. Instead, eat a healthy diet such as fresh fruits and vegetables. These healthy habits may improve one's overall health. Second one is supplement intake. Okay, one should consume vitamin and mineral supplement consistently because both of these are very useful with their high antioxidant properties that can prevent damage to the sperm making process. Okay, and last treatment for male sterility is HCG treatment. So what is HCG treatment? HCG treatment is human chorionic gonadotropin that acts like LH, which is a luteinizing hormone. It is often in combination with recombinant human follicle stimulating hormone, RH, FSH, is given. The goal is to achieve normal blood hormone levels so the body can produce enough sperm. Next, we move on to treatment for women. There are also 3 treatments for women, which are fertility drug intake, surgery to restore fertility, and reproductive assistance. So first one, I'm going to explain regarding fertility drug intake. So by consuming clomiphene citrate, this drug stimulates ovulation in the ovary by causing the pituitary gland to release more FSH and LH, which stimulate the growth of an ovarian follicle containing an egg. Okay. Second one is surgery to restore fertility. For women who had their fallopian tubes blockage or even filled with fluid, conducting laparoscopic surgery may help to remove adhesions, dilate a tube, or even create a new tubal opening. So as a result, chances of getting pregnant with in vitro fertilization (IVF) will improve. Last but not least in my topic is reproductive assistance. Intra-uterine insemination (IUI) method are conducted by placing healthy sperm directly into the uterus around the time that the ovary releases one or even more eggs to be fertilized. That's all. Thank you.
There are a few preventions that we can practice to reduce the risk of infertility. First, maintaining healthy weight. Being overweight or underweight are significantly affect your ability to conceive. For women, maintaining an appropriate weight and participating in moderate exercise can help improve menstrual regularity and overall health. Next, control relatively less fertile than their relaxed counterpart. It is because stress can trigger a vicious circle of unhealthy behavior which makes conception difficult. Therefore, proactively handling stress can be effective in the prevention of infertility. Other than that, don't smoke. It can adversely affect hormone production, making it difficult for you to conceive. That can also damage the DNA in the sperm. Thus, smoking has negative effects that can lower your chance for pregnancy and increase the risk of miscarriage. Last but not least, we need to avoid exposure to environment toxins, especially for men. Common toxins such as lead, mercury, and other chemical compounds can be metabolized into secondary products, which adversely affect the reproductive tract and affect the sperm of production.